I'm really, really happy that Greg let us twist his arm, and Jeremy in 2 weeks will, have a response to talk to us about the connection between the motor system and the auditory system. And as much as I'd like for them to be separate systems so we can easily talk about one at a time, the world's not that nice. And so I'm looking forward to hearing how they're connected. So Greg, can you tell us more?
Yes, I can. Shall I present? So I have a set of slides that we can kind of riff off of, but I'm more than happy to just discuss too. So I'm very open to whatever kind of format we want to do.
Well, I think we need to present some stuff at least.
Okay, I'm ready to do that. So let me.
Hopefully the technology all works to get still.
Yep. Okay. Can you all see my presentation?
Yep.
Okay. Good. All right. So I don't think we can study the auditory system independently of other systems, and I think it's important to think about it in relation to what it's being used for. And the big idea that David Popple and I have been promoting for 20 years now is that the auditory information is used for at least two different things, three probably, if we count emotional systems. And it's useful to think about how auditory systems interact with these two separate systems. One of them, of course, is understanding what it is that you're hearing, recognizing sounds, speech, whatever. And that seems to involve one stream. Another stream seems to involve interaction with the motor system. And that's what we're going to focus on today. So, so here we go. One of the main, first questions you could ask is, do auditory and motor systems interact? And I think the answer is uncontroversially yes, they do interact. Lots of research on this now. I just want to point out that even before there was a lot of interest in auditory motor interaction, I had demonstrated with my grad student then, Brad Buxbaum, quite clearly that they do interact. And this is one of our early studies, fMRI studies, where we had people, can you guys see my cursor? Okay, cool. We had people listening to speech. So this is some auditory input. This is 3 nonsense words for what it's worth. It doesn't much matter. And then we had them silently rehearse it. So imagine saying those words over and over again for several seconds. And what we were interested in was areas that seemed to respond well to the listening part as well as to the covert rehearsal part. So now there's no auditory input during this phase. And so you can see this curve here looks like a straightforward auditory response. It just responds when the sound comes in and then drops off. This is a tone that tells them to stop rehearsing, so we get another little blip in the acoustic response. Here's a response that looks like it only cares about the rehearsal part, doesn't come up until the rehearsal starts. And here's the one that we were interested in. You get a nice spike at the beginning and then a sustained response during the rehearsal phase. So that's an auditory motor response. And in the hashes here, you can see where those combined auditory motor responses are. And they're all over the place. In my lab, I've been focusing on this area we call SPT. We'll come back to that. But you can see it in auditory cortex, like high-level STG, and you see it prominently in motor cortex. So this is like Broca's area. This is the more dorsal premotor site, all showing this auditory motor pattern. So yes, they interact.
Wait a minute, sorry.
Sure.
I mean, that also could be a language center of some sort, though, too, right? The combined.
It could, yeah. We're not differentiating between the source of it exactly. We did do a follow-up study to this one. The very next study we did was aimed at trying to see whether it was a speech, was it phonologically sensitive? It was just responding to the phonology. So we had people doing this task, and then we had people doing the same task, but listening to simple melodies. So just simple tonal piano note melodies, and then imagine humming them. And we found exactly the same activation. Surprised me. But we found just as much, if not more, activity to the, at least in this SPT zone, which is what we were mostly interested in. So yeah, it doesn't seem to be speech selective.
Excuse me, if you play noise or something so that they have another auditory signal going on while they're rehearsing the speech, does it affect it? What you see?
We haven't tried doing that. I don't think it does, at least not in the areas that we've been focusing on, like this posterior planum. That's not an, I think I have some slides about this, but this posterior region is not auditory cortex. Cytoarchitectonically, it looks like it's area TPT, which is not auditory cortex. So it's more of an auditory motor zone is how we've framed it.
Greg, have you ruled out some kind of subvocal activation when they're, rehearsing?
Subvocal activation, you mean like actual movement?
Yeah, like some kind of, they're not actually making a sound or producing a sound, but when they're thinking of rehearsing it, or they're actually in their mind, that there's some kind of activation of laryngeal muscles or vocal apparatus, even though they're not.
Yeah, we haven't specifically done that. We have done a version of this task where we ask people to articulate without phonating and compare that to imagined speech. And you do get differences, interesting differences, but the same kind of network shows up. I don't think it's that necessarily. In any case, that's kind of, there are plenty of demonstrations of, the main point of this slide is that you get motor related activity during listening. And in the context of this task, we see it, and many other people have demonstrated just passive listening to speech. You can find evidence of motor cortex activation. So this is uncontroversial as far as I can tell. The question is, what is the relation between these things? And I can imagine three kind of extreme views. One is that there's some sort of auditory motor symmetry, which is that auditory perception and motor control is all just one big happy system. So perception critically involves motor systems, action critically involves perceptual systems. It's just, and perhaps the implication of that is that there's no meaningful distinction between auditory and motor cortex at all. I think that's wrong, as we'll see. Another view, a second view, is a kind of motor-centric asymmetric relation. That is, both action and perception critically involve the motor system. So this idea is kind of related to the motor theories of perception, the motor theory of speech perception. At least the early version said that you absolutely need motor cortex in order to perceive speech sounds. And you couldn't do it with just an auditory system. The other view is that the other extreme is an auditory-centric asymmetric relation. So both action and perception critically involve the auditory system. Okay, and that's essentially what motor control models claim. That is, action is dependent on sensory targets that actions are aiming to hit. We'll talk about all these different options. So these clear. So I mean, this is a continuum, of course. There are extreme views on a continuum where they're perfectly symmetric in the middle versus completely audiocentric on one side and completely motor-centric on the other side. The question is, where is the truth? And can it vary by task, stimulus conditions? Does it vary by whether we're talking about development or the mature state of the system? And all of these are variables that would need to be looked into to get a complete answer to these questions. So first...
just a quick question. So,
yeah.
Along that continuum, are you talking about, let's say, speech production or speech perception? I mean,
yeah,
presumably
so
you go to one or the other depending on the tasks.
Yeah, exactly. So depending on the task. So an audiocentric view would say that speech perception doesn't need the motor system at all. You can take it out, you can not develop one, and speech perception will happen. However, if you don't have an auditory system, speech production isn't going to happen. That is, speech production needs an auditory system. And vice versa for the motor system. If you take it out, you're obviously not going to be able to talk because you don't have a motor system, but neither will you be able to perceive speech. So those are the extreme views.
Thanks.
Okay, so I want to point out there's plenty of evidence that the extreme motor view is empirically false, and that's the motor theory of speech perception even the proponents of it backed off on the hardcore claims that they started with, and argued instead that it was not the codes for the motor gestures of speech that was enabling speech perception, but it was the more abstract gestures, some more abstract motor representations. So they backed off a bit. Some of the evidence, and this is just a list of various sources of evidence, is that if you damage the motor speech system in a variety of ways, you can get severe speech production deficits. But you don't see a similar effect in speech recognition. Okay, you don't see the magnitude of the same effect, and this includes damage to M1, damage to Broca's area. Broca's aphasia is obviously one example. You can damage Broca's area bilaterally and not have the problem. Anterior operculum, which produces a opercular syndrome. I'll talk about that in a second, where you can have a complete anarthria, inability to talk, and still perceive speech normally. Large frontoparietal cortex lesions, it includes complete mutism induced by left hemisphere deactivation. This is a study we did in 2008, where people couldn't speak because the entire left hemisphere was deactivated, and yet they were able to perform reasonably well on a word picture matching task with phonological foils. Other work in development, if you don't develop normal speech production, for example, in developmental or acquired anarthria or in cerebral palsy, it does not preclude normal speech recognition. In that Bishop 1990 study, Dorothy Bishop is a great example of that in cerebral palsied young people. So yeah, you don't need to have normal speech production even developed to get normal speech perception. Infants, of course, are known to have pretty decent speech perception abilities before they are able to talk. And there are, of course, the demonstrations from animals, chinchillas and quail can at least perform discrimination tasks on speech sounds that look kind of like categorical perception, so pretty decent. So you don't need to have an intact system in order to perceive, or even the genetic capability to develop speech production to perceive speech reasonably well. Here's a recent case that we've been looking at. Opercular syndrome is often, there are developmental versions of this caused by perinatal strokes or other kinds of abnormalities. Basically, if you have damage to the opercular regions of the inferior frontal cortex, you produce a severe anarthria. So no voluntary control of the oral or vocal apparatus. So this is the case that we've been studying, and you can see, the lesions are never as clean as you want. This is a surgical resection for treatment of epilepsy. And you can see that, we're taking out most of lower sensory motor cortex, including parts of Broca's area on the left, and a lesion on the right that is including many of those areas. We tested their ability to comprehend words. So this is a word comprehension task. You say the word bear. You have they're pointing to the task is to point to the correct picture. You have a phonemic foil that is a minimal contrast. So if they're having trouble perceiving sounds, they're going to mix these up. You have a semantic foil, and then you have an unrelated foil that's phonologically or semantically related to the phonological foil. This is a task that we've used in aphasia populations as well. This person, despite having no speech production ability, is 100% on this task. Do the same kind of task with a word discrimination, and accuracy is also quite near ceiling. If you present word comprehension and noise, so another idea is that comprehension and noise is something that the motor system is really needed for. So we did that, and the person performed at 80% correct. The control range was 80 to 95% correct, so not excessively abnormal. So basically what we're seeing is, despite severe speech production problems and damage to presumably motor speech areas, you can get pretty good word comprehension abilities. Interestingly, if you just change the phonemes in the words in the discrimination task, so to make them non-words, this person fell to pretty poor levels of discrimination ability. So non-word discrimination is impaired. My interpretation of this, and we can discuss it, is that word discrimination allows you to hear the word, an individual word, bear, and then you understand it. You have this concept of a bear via your, what I would call a ventral stream network, that allows you to access the lexical item and the meaning of the word. Then you hear another word, you process the phonological information, correctly access the word pair and its associated meaning, and then you have two different meanings, and you can compare the meanings, and they're different, referring to different items. With non-words, you have to do all of that work at the phonological level. You can't normally comprehend it, and so you end up you end up having to do a kind of working memory task. Not a very demanding working memory task, but you still have to code that phonological sequence and compare them, and now you get some problems. So it looks like the motor system may be important for doing these sorts of things, which is, again, what David Popple and I had talked about years ago.
What's the control for non-word?
What's the control for non-word?
Yeah, how do control people perform from non-word?
Oh, perfectly. Ceiling. Yeah, in fact, we have another case that I'm not talking about. It's a little less clean, who also had a opercular syndrome behaviorally, and she was perfect on both of these tasks. So even here, it may be slightly different. I see a couple hands up. Irv? No?
Can I ask a question?
Of course.
Yeah, so you said when there is no semantics involved, you are willing to say that the system involved as a perceptual level.
Yeah, you were cutting out a little
correct,
bit,
or
but
am
I think I know what you were going to say, Shihab. I'm willing to say that, and I believe that the motor system, a motor speech system, does get involved when we're doing discrimination tasks. But that's not an auditory thing in my view. That is, in order to perform this task, it is helpful to recode what you're hearing correctly in motor speech representations. So kind of like a working memory, rehearsing a phone number, that kind of thing, when we used to have to rehearse phone numbers. So that's where I think the motor contribution is coming. It's not in normal speech comprehension. It's when you're asked to do a contrived laboratory task that we don't do in the wild, so to speak.
So you wouldn't call this that the motor system is helping in the perception of phonemes, the perception of syllables, without semantics.
Exactly right. It's not helping in the perception, and the way we know that is because the system can correctly interpret these words, which involve the same phoneme discrimination. So we know that the auditory system is capable of resolving the difference between a B and a P sound, because they can understand bear and pair. The problem comes when you ask the person to do a different kind of task. And I would argue that the difference is that the motor system is helping with the task, not the perception.
So you would postulate that a non-English speaker would not be able to perform at 96% in the upper task.
A normal, I'm sorry, say that again?
The bear pair,
yeah,
would not achieve 96% for a non-English speaker.
For a non-English speaker, if you didn't know those words,
yeah,
that's correct. Yeah.
Okay.
That's right. There's one question that might be worth answering in the chat. Is the motor system defined here solely based on canonical anatomy, or does it have a functional definition? Kind of both. If we go back to the lesion, it is behaviorally, functionally defined because this person is completely anarthric. So that's we found people who can't talk, can't even verbally or voluntarily control their vocal tract to stick out their tongue. And also that the lesions are in regions that we think are important for speech production. Okay, so it's both. The reason I'm not presenting the other case, I mean, I'm happy to talk about it, and the paper we're working on presents both. But one lesion is kind of in the left hemisphere is the same, but the other lesion is actually in more posterior parietal areas, which is probably disconnecting right hemisphere motor areas rather than damaging them directly. So it's a less clean case. But so that would be, I'm looking at the case that has both the behavioral, functional damage to the motor system, as well as the lesions that correspond to where we think they live.
Liberty, Liberty, can you ask?
Can I?
Yeah, actually, this question is maybe slightly off topic, but I'm curious about the fact that there was a bilateral resection. Were these cleared using language mapping? Because normally that would only happen if the stimulation mapping had shown that they were.
Yeah, this
not required.
Good question, Liberty. This resection was not done by our group. Of course, I'm not a neurosurgeon. Nitin Tandon is the neurosurgeon that I work with, as you know, Liberty, and he did not do this surgery. So I don't know what the circumstances are for the actual clinical treatment. Yeah, it's unfortunate. It's a tragic case, actually.
Thanks. And then I have one more question that is related. So for the non-word discrimination, did you find that it was specific phonological contrasts that were more or less difficult to do? And was it always the initial consonant that was used, or?
I think I'd have to go back and look at the stimulus. Some are harder than others, it's true. And I'm not sure, I don't have those details for you right now. But it wasn't a super, psychophysics-like task. So it was a task that we put together years ago to study stroke aphasia. And we have lots of data on stroke aphasia. And you get on average, you get kind of the same effect. In general, people with aphasia are worse on the non-word discrimination than the word discrimination.
Jeremy had a question.
Can I have a question?
As more of a clarification from Greg. Greg, what's the time course of opercular syndrome? Does it clear up eventually, or is it permanent?
Permanent,
damage?
yeah.
Okay, I was just curious.
Yeah.
A more fundamental question, if I may.
Yep.
Well, if we say that the speech that's developed, evolutionarily speaking, we just took advantage of a vocal tract and use it for communication. That means that we are not focusing on speech sounds, but the movements essentially. So it's a continuously ongoing process, dynamic process, which involves the motor system, obviously, and also the auditory system itself, because speech is not a chain of steady state sounds, but is definitely a motion. So the two are absolutely parallel, and that can be fitted in the old motor theory as well as any of the things that you have been mentioning. Can you please comment?
I'm not sure I understand. I'm not sure I understand the point. Can you phrase it as?
Well, why don't you try to address the question? How do you think our speech system, whether it is auditory or motor or both, has evolved?
How has it evolved?
Yes.
I think that's a complicated question. I mean, we could talk about the evolution of speech and language control. I think they're really interesting issues. Probably there are separate stages of evolution. I think probably just one idea is that getting control of the larynx, voluntary control of the larynx, is something that our species was able to achieve that other great apes don't have. So that was one stage. And then the ability to control the supralaryngeal vocal tract probably requires other circuits. I've done a little bit of work in thinking about that, and maybe we could talk about that at the end. But we've got a bunch more to talk about. Here, one quick question. The noise was just white noise, nothing fancy for the speech and noise task. So basically the point of this section is to argue or point out that the evidence is pretty strong that an extreme version of the motor system, motor theory, is incorrect. It's not viable, which is why most people, probably Jeremy included, you can nod or shake your head, that the current thinking is that that it's augmenting the normal process to some extent, and so it's kind of a little bit shifted on the continuum, and the question is, how shifted on the continuum is it? So I don't think anyone really defends an extreme version of the motor theory these days. So the next question we can ask is, does motor disruption affect speech perception? So there is evidence that it does to some extent. So there are TMS studies that suggest yes, some high-profile ones. Here's a couple of examples. Basically, you stimulate and interrupt function in premotor cortex or the motor cortex itself, and you can find some disruptions. But the question is, by how much? What's the effect size? And the effect size tends to be about 10% or less. That's something, but it's not like a dramatic effect. And this holds under certain conditions. Specifically, you have to be near threshold signal-to-noise ratios. So if you just present clear speech, there is no effect. And all of these studies use non-word syllable tasks. So the kinds of tasks that I highlighted here, where you get this difference between normal kind of word comprehension-based processes versus more contrived focus on the phonemes kind of tasks. And all of these studies that show these effects are using these kind of non-word syllable tasks, okay? We tried to estimate the effect size psychometrically instead of using TMS, we used articulatory suppression. So we asked people while they're doing a discrimination task to subvocally articulate, to keep the motor system busy so it couldn't contribute to the task. And here's basically what we found. We were able to replicate, and this was a pre-registered study, we were able to replicate roughly the effect size that's seen in TMS, so 8% decrement under articulatory suppression conditions. So I believe that effect is real. So similar to TMS studies, but we did a psychometric function and basically estimate that the motor contribution is about 1 dB at threshold SNRs using unnatural speech tasks. So in my view, the motor system is producing some effect, but it's really probably inconsequential in normal speech.
But didn't you say a few slides ago that from the non-speech word perception stuff with those patients that were disabled, that motor system wasn't involved in that case?
No, I think the motor system, so basically I think the motor system is involved in helping out on tasks, not the perception. So both of these cases require perception and discrimination or differentiation of these phonemes, P and B in this example, right? But you change so if you can show that under one task condition, they're fine, but under another task condition, they're not fine, that suggests that it's the task that the motor system is helping out with, not the perception, right? Because we can demonstrate normal perception in at least one case. And I think that's what's happening in TMS, is that the tasks that are being used are syllable discrimination-like tasks that are going to recruit the motor system to some extent to help out with the task, and that's what's being interrupted. And when you estimate the magnitude of that effect, it's about 1 dB, so small, even under those conditions, where the conditions are threshold SNRs. So if you present this task with articulatory suppression at high signal-to-noise ratios, you don't get an effect at all. Performance is at ceiling. You have to be near threshold, and then you have to use these funky tasks. So from my perspective, yes, the motor system is contributing to speech perception, quotes, but it's contributing under contrived laboratory conditions. So it has to be noisy with no real-world constraints. Okay, and my assumption at this point is that it has absolutely no real impact in the wild as we normally use speech. Okay.
And
So, So basically my position based on these data, what I'm arguing is that this whole path of this continuum can be completely ruled out. Okay, and the truth lies somewhere here. Okay. Let's see if there's any questions I should answer in the chat.
Greg, I have a question while you're doing that.
Yeah.
You can multitask.
Yeah.
Probably need your motor system for that. Just a question about TMS. I mean, TMS is a weird methodology, right? So I wouldn't expect it to have much of an effect. I mean, you have an intact nervous system that you're zapping, and you would kind of expect the rest of if the motor system were playing a role, to pick up some of the slack, so some kind of rapid reorganization. So that you're even seeing a 10% effect. From the viewpoint of people who think that the motor system plays more of a role, is actually fairly special.
Yeah, I think that's a fair point, Jeremy. If TMS were our only data, if all we had was TMS and we're like, hey, we're getting a 8-10% effect, and given how kind of sketchy TMS can be, and we're only stimulating a little teeny spot, that's pretty impressive, right? But then you look at cases of opercular syndrome or all these other examples where you wipe out the motor system and you don't get an effect. And so at some point,
in the case of
an effect it's substantial.
Sorry, I didn't mean to interrupt. But in the case of opercular syndrome, you haven't lost the entire motor system. I see what you mean, though. You've lost the articulatory abilities, but you've also damaged a huge part of the brain bilaterally.
I know.
Yeah.
Right. So equally, it's surprising that they're doing so well then, right? So this is
That's what I mean, yeah.
Other question, if I may. If you listen to speech in a foreign language that you understand, but you may not be able to speak perfectly well, that you can still understand it, how do you square the two systems?
That's maybe a question for Jeremy, right? So that's a case where you don't have proficient production, and yet your perception is good. So that would be another kind of probably weaker example of the same point that I'm trying to make here. I mean, I want to just say one more comment about what Jeremy is saying, which is if you take any one of these studies that I talk about, you can poke holes in it, right? The TMS, 10%, that's not bad. Or you look at the opercular syndrome. Wow, these are odd cases. Maybe it's the fact that you had the motor system available during development, or maybe the case doesn't damage the right part of the motor system. Okay, but the problem is you look at all these examples and you still get minimal to no effects in speech perception with motor damage. And at some point, we're going to need to see a clear example in order to buy the motor, some motor-centric view. We're going to need a clear example where there is positive evidence for a substantial deficit in speech perception. That is, it happens in clear speech. It happens during normal word comprehension when you take out the motor system. And we absolutely do not have that now. That's the point. One point I want to answer in the question about prosodic aspects in these opercular cases. We didn't assess that, so I can't answer that question. I'm sorry. I wish we would have. Working memory was impaired in these patients. So the one that I presented here, non-word span was 2. Okay, so quite bad.
So as you know, the perception of speech and recognition, or whatever the term is really only tangentially related to the vocal tract per se. I mean, you could have completely normal linguistic exchange and all that with hand signals and sign language and all of that. So I have 2 questions. One is are there any data from sign language that address this issue, especially since there's a lot of visual input, we have multimodal stuff involved? The other question that I have is, how much of the data you're describing has to do with development versus an adult having a problem? Mm-hmm. I mean, it could be that you basically learn about recognition of words and all of that stuff over life, needing the motor system. But after that, you don't need it. Once you are able to do the perception and the recognition, then you don't need anymore the motor system. It's only needed, let's say, for learning the words and go ahead.
Yeah, so to answer your first question, sign language, I've done a little bit of work on that. It hasn't been studied at a kind of psychophysical level, but there are in sign language cases of Broca's aphasia for sign language, where you have severe production problems for sign language, and comprehension seems to be normal. So to a first approximation, you don't see those effects. There are plenty of studies of apraxia, limb apraxia, that can address some of the manual. Can you comprehend gestures, meaningful gestures, even if you can't produce them? And it seems you can. But that's a whole other issue. I addressed that a little bit in my mirror neuron book. If you're interested, we could talk about that. Regarding the developmental thing, I think it's a very interesting question. There are cases of developmental anarthria where the patients have never learned to speak, like the Dorothy Bishop study in the case of severe cerebral palsy. And speech perception is normal under the right task conditions. So then the question will be, well, they didn't, maybe it's a low-level motor problem, and really the higher-level motor centers are there and intact and doing their thing. The motor view just gets pushed farther and farther into a corner the more data you look at. So it has to be that you don't need to actually be able to articulate motor speech to acquire that, to acquire the perceptual ability. That's absolutely true. Based on existing data, so it would have to be something higher level. And then you look at chinchillas and quail, who seem to be able to perceive speech sounds quite well, and they can learn to perform these tasks, and they don't have the genetic capacity for speech at all. So a motor view is going to have to address all of those data points at some point. But yes, I think there may be some subtle motor influence on auditory perceptual categories. So, for example, Jean-Luc Schwartz at Grenoble has argued, interestingly, that that having the motor capacity, these motor categories for phonemes, actually influences how you end up categorizing them perceptually. That's possible, and something that is worth exploring in more detail. But the role of the motor system is becoming very small in any of these models. Highly constrained by the data. All right, we should move on, I think. In contrast, an audiocentric view has quite strong support. So obviously, if you're born deaf, you're not going to be able to produce speech normally. You need to be able to hear the sounds in order to produce them. That's uncontroversial. We know that late onset deafness, so if one of us became deaf at this stage in our lives, our articulatory ability would decline. You can prevent auditory feedback and still articulate normally, but over time, the motor codes seem to drift, and they end up not being corrected with that auditory feedback, and so you end up with decline. In the lab, we know that altered auditory feedback can induce rapid compensatory responses. So these are studies where you ask people, in a simple case, you ask them to phonate. They just say, ah, something like that for several seconds. You in real time introduce either a pitch or a formant perturbation. You shift the pitch or the formant up or down, and you can get a kind of unconscious reflex-like compensation for that. And so we know that online, in real time, the motor system is paying attention to the auditory system. We know that continuous exposure to shifted auditory phonetic information, like if you move into a different linguistic environment, can lead to persistent changes in speech articulation. So you might pick up the vowel pattern of the people around you to some extent. There's constraints on that, obviously, but it happens. It's referred to as gestural drift. So just for example, I grew up mostly in Southern California, but then went to school in Boston, graduate school in Boston, and hung out with a lot of Canadians. For about a decade after I moved back to California, people thought I was Canadian. I just picked up the vowel pattern. And so presumably what's happening there is that you're hearing these different auditory targets and you're coding them in your auditory system. This is how a vowel is supposed to sound. That becomes some form of an auditory memory that your motor system is then trying to hit, okay? And that ends up shifting your articulatory patterns. And we know that disruption of auditory systems with stroke can impact speech production, for example, in conduction aphasia. And we know that the auditory cortex responds differently to self versus other produced speech. So I'm going to talk about these last 2 points. Conduction aphasia is an interesting syndrome. It is caused by damage to the posterior temporal parietal region. It was thought initially to be caused by damage to the arcuate fasciculus. That turns out to be incorrect. It's a cortical syndrome. And then it was thought to be the temporal parietal junction. So this region up here. But it's probably not the whole story. We know from previous work that if you damage auditory cortex, you can end up with conduction aphasia. And this is some unpublished work from the group that I work with showing a lot of superior temporal damage involved in conduction aphasia. So basically the point here is that you can damage high-level auditory systems in the STG and end up with some speech production problems that are quite substantial. So that's the lesion case for auditory involvement in speech production. Another effect is what's referred to as motor-induced suppression of auditory cortex. So this is a fairly well-established thing. Jonathan might have something to say about it. I think I recall some work in animals that you did, Jonathan. But in any case, here's the basic results. If you ask people to talk, this is an MEG study, and look at the auditory response to perceiving their own speech, it tends to be attenuated relative to tape playback of that same sound. Okay, so the idea there is that you're kind of like a saccadic suppression, where you're suppressing the sensory signals coming in the eyes so that you don't perceive the world moving every time you move your eyes. In the same way, you're kind of suppressing the acoustic response to your own speech. So it doesn't sound like it's coming from someone else. We did recently with Nitin Tandon and his group in Houston. We looked at this in auditory cortex intracranially. So here's a study that involved, it was recently published in Nature Communications. There were depth probes, so we're actually in auditory cortex, and they were oriented along the supratemporal plane. So we were going through Heschel's gyrus and the STG. And we presented AM noise stems, so modulated at 3 hertz, and then simple sentences like a place with sand along a shore, which is part of a task, where the patient would then name the thing that the sentence refers to. So the naming part of the task would be for them to say beach. And we looked at a bunch of different things. I'm not going to highlight everything we did in the study, but we found envelope tracking or entrainment, however you like to think about it, in some locations, and that's these blue locations. So here's Heschel's gyrus, anterior, posterior, and we got some, this is gamma power up here. We got entrainment-like responses or envelope tracking responses in mostly in and around Heschel's gyrus. Other regions kind of replicating Liberty Hamilton's work in more posterior zones. We found onset-only responses in other areas. And I think, Liberty, you were recording from the surface with grids. This is inside the sylvian fissure, so right in auditory cortex. So some nice convergence there. So what happens when the people are actually talking? Well, when you're listening, so here's a listening response here under electrodes or at electrodes that are responding continuously, so showing that entrainment response. Here's the onset response in other electrodes, mostly posterior in the planum, so that's during listening. When the person is talking, we can look at the auditory response as well and notice that we still see in the entrain and the electrodes that respond continuously throughout the speech, we still get a response to self-produced speech. But the onset response in planum is completely suppressed, just absolutely zero when the person is talking. So there's something happening when we talk that is different than when we're listening. That's just an empirical observation. What it means is something that we're trying to work out, and there are various ideas from Liberty has worked on this with Eddie Chang, and we have some other ideas, and it's not quite resolved in my view. So that's that. So that's kind of the brief case for auditory involvement in speech production. So the next question then would be, how do auditory and motor systems interact? And this is where I've been doing a fair amount of work. I focus on this what I call auditory motor area SPT, which we started investigating because we thought it was a homologue to visual motor areas in the intraparietal sulcus, which show auditory motor response properties. They're organized around motor effector systems and so on. And so this was, the study that I reported was kind of the standard paradigm that we used, which is listening and then silently rehearsing. And we find activity in this SPT zone. Now, we focus on this because it is quite close to these intraparietal areas, and it had the right cytoarchitectonic properties to play the role of an auditory motor integration region. This is data from the music versus speech study, and you can see that you get activity to the listening part here. You get a sustained activity during listening or during rehearsal or humming, same level of activity, and then it shuts down when they rest. Functionally, this region seems to be connected to the inferior frontal gyrus, at least based on functional connectivity-like measures. You can do tractography using the seed of this SPT area and show connectivity between motor and high-level auditory areas, STG. We've demonstrated motor effector selectivity. So if we have skilled pianists listening to melodies and either humming or playing them, imagine playing them, we get more activity in SPT for the humming than for the playing. And this is just kind of showing where this SPT region is. This is an aggregate analysis of over 100 fMRI scans from different kinds of tasks showing the location of SPT. And this is kind of a cartoon version of the Galaberta result, cytoarchitectonic result, showing this is area TPT in the posterior planum, which is not auditory cortex. The way I think of what's happening in terms of this auditory motor integration, so the question of this, or the topic of this discussion, is do they interact, how do they interact? And the way I think of it is in a motor control framework. So I think of auditory representations as coding the sensory targets for speech production acts. Just like when you're reaching for an object, you code the sensory features of that object in your visual system, and then you translate that into a motor plan for interacting with that object. I believe the same thing is happening in speech, except that the speech targets are not objects out in the environment. They are coded memories in high-level auditory cortex that we are trying to hit, basically, with our speech articulation action. So this is the kind of model that I've been developing, where the auditory system codes the sensory targets for production. The motor system is aiming to hit those targets, which means try to reproduce those sounds. This is an internal model, so you basically, the system can learn how to generate motor plans to hit those targets. It's constantly monitoring and tuning this mapping and so on. And so that's kind of the model. That's the way I've been thinking about it, and that's all of the prepared stuff that I have here. So I have lots more to talk about this stuff, but I didn't want to just make it a complete lecture and be able to talk more. And I see there's a lot of questions in the chat section. So shall I start going through the chats, or shall I?
Greg, I wanted to ask one question first.
Please.
What's at the boundary between speech and non-speech? I mean, you have a model that's talking about, production and perception and that. I mean, what happens with things that aren't quite speech, like sine wave speech or onomatopoeia sounds, or things that you wouldn't necessarily code as language?
In terms of perception?
Well, in terms of the motor system.
In terms of the motor system, there have been some studies along those lines. So, so one question that I often get, and maybe this isn't exactly answering your question, but I think it might in the end, is so my view is that the auditory and motor systems are indeed tightly related, and they're tightly related for the purpose of talking, not for the purpose of perceiving. So one thing that people ask me is, well, if it really is all about talking, why does the motor system regularly activate to speech, even when the person has no intention of talking? And that's a good question. And I think the answer is that, well, you have a network that's functionally connected. So the same reason why we prime, when we hear doctor, we prime nurse, it's spreading activation through a densely connected network that produces this activity. And there's some suggestive evidence that this is the case. So one study that a former student did looked at the motor effect, the strength of the activation as a function of the phonotactic frequency of the words they were hearing. So if there was a very common phonemic sequence, you got more motor activity than if it was a less common, as if those connections were more strongly reinforced into the motor system. So to get to your question, I think for things that aren't tightly or highly learned in terms of motor action, so sounds that don't have highly learned motor corollaries, you would get less motor activity. I think that's the answer to the question, and that probably just reflects learning, sensory motor learning for the purpose of speech production. Does that kind of get at your question?
Yeah. You should look at some of the chat questions. I don't know if anybody wants to speak up. It's been
Yeah, I know there's a ton. I see Jack agrees with some things. Greg, so you're arguing that the motor contribution is about the working memory demands of these kinds of tasks. Yes, basically. Or working memory is the problem with the working memory argument. So if you're discriminating between bear and pair, or the non-word correlates of that, that's from a working memory standpoint, that is a really easy task, right? So people have, when I said this has something to do with motor recoding and working memory and so on, people say, well, you don't need much working memory to tell the difference between two words. And I think that's true. There's a difference though. So let me just throw this out at you. If I ask you, for example, to tell me whether I uttered the syllable ba in the last sentence, would you be able to tell me? You don't know. Now I can ask you to listen for ba in the next sentences that I utter. And now you're doing something different, right? You're actively monitoring consciously the sound patterns coming out of my mouth. That's not something that we normally do. What we're asking patients to do when we're asking them to listen for a ba or discriminate ba from pa, we're asking them to do what you all were just doing, listening for ba in my speech. And my idea is that the motor system is somehow, and I don't know how, involved in that conscious attention to speech sounds. That's part of phonological working memory, I think, but I think there's some extra bit. And that's really what's getting disrupted when you damage the motor system, is the ability to consciously attend to the sublexical structure of speech. So that's one comment. I'm just going to keep looking through, but feel free to jump in on any of these topics. What about the large amount of literature in music cognition showing the involvement of the motor system in auditory perception? Does this implicate the motor system and auditory perception to some degree? Music, I mean, professional musicians who play an instrument are interesting because they not only perceive music like the rest of us do, non-musicians, but they also know how to produce it. So yes, I think it's unsurprising from a sensory motor standpoint that you get stronger connections with the motor system in professional musicians who have motor codes that are designed to hit those auditory targets, same as speech. So it's an interesting example. I don't think it implicates the motor system in perception. What you'd want to do is to find a musician or compare musicians and non-musicians to see if they can, equally perceive speech or music in a natural way. Again, we have to be careful with the task and not make it a contrived task where it helps them to recode it in motor terms. Jack says, both during speech perception and music perception, activation throughout the motor system is quite low and motor features do not predict well in the motor system. So I think that's agreeing with my position. If there are motor responses during speech perception, one possibility is that this activity is related to action words. A similar thing is seen in vision, where some have reported small motor system activation while people watch movies. Yes. Yeah, there's a whole other kind of embodied cognition literature, which is looking at motor involvement in the perception of verbs, things that involve action. That's another topic. I don't necessarily think there's much there either, but we could talk about it. Certainly, it does seem to produce activation levels that differ. Why was it previously thought that arcuate fasciculus damage causes conduction aphasia? That goes back to the classical aphasiologist times, where it was thought a disconnection between Wernicke's and Broca's area was the cause of conduction aphasia. But the evidence for that is nil, basically, at least with respect to the arcuate fasciculus. Matt Leonard says another possibility is that motor areas have auditory or at least sensory motor circuits. So I think it's really important here to specifically define what motor means. Yeah, this is a really interesting question. So one study that we're working on, a study that's done, but a paper that we're working on, an analysis that we're working on, and the we here is John Venezia, who has done some work with me, mapping STRFs in auditory cortex to speech using a bubbles method, which is basically where you filter out portions of the modulation spectrum and use the brain's response to classify, to figure out, what the maximal response in modulation space, what are the tuning curves basically in modulation space for these different regions. We focused on auditory cortex in the study we published and found some interesting results. But looking back at the data, we are seeing a premotor site, dorsal premotor, kind of like the dorsal, kind of in this zone here, the dorsal region that we often see in our SPT paradigm, that looks like it's nicely tuned to acoustically tuned. And the acoustic tuning looks a lot like primary auditory cortex. So we're working on that. And so the point that there may be auditory tuning or auditory related areas in motor cortex, I think, is real. And the question is, what is it doing? Is it translating to some motor plans? We have some ideas about it being sensitive to prosody and things like that, because it does seem to be pitch tuned. But in any case, I think that's important in an area that needs to be studied carefully. So stay tuned on that. We should have a paper in a couple months, at least a draft of something for you all to look at.
Greg, what do you say?
Can I have a question, just a general, Malcolm? For a question?
Go ahead,
Yeah.
yeah.
Yep.
Yeah, so I just want you to comment on sort of like the opposite point of view, like this. When you are trying to speak, when I show you a picture of an apple and you're supposed to utter the words to generate the speech or the word, you go through from, as you said, from abstract concept to motor commands that control the vocal tract, and then all the way out to the acoustics. And presumably a huge amount of areas are involved in mapping the abstract to the vocal tract commands.
Right.
These areas are very much involved also presumably in the auditory reception of the word apple. So you hear apple, it goes into the abstract concept. I cannot imagine why would the brain build the same areas that do from to vocal tract commands would be completely unrelated to the areas that take the same auditory stimuli that these vocal tract commands produce and map them to abstract, and it would be unrelated.
Yeah, so that's
that
exactly
the point of view. This argues that it's hard to imagine how perception and production are so distinct, 10% only.
Yes, so they are not distinct on the production side. So this is exactly the model that I've been working on for 20 years. This is what I've been doing. So that higher level stuff that you're talking about, Shihab, is this stuff, and I've collapsed it into one box. But it's, we can point to the. Let me just go to a brain image. So the general view is that these dorsal STG areas are coding so for perception, for recognition. You code the speech sounds here and recognize them in the STG STS. A region in the middle temporal gyrus seems to be involved in lexical or word level recognition. So that's a thing. We call it a lemma in psycholinguistics. You can think of it as an intermediate level in computational terms, mapping from phonology to concepts, which seems to be more broadly distributed in anterior temporal, posterior TPJ regions. And so this is the ventral stream. It kind of, you're mapping between those things, and that's recognition. Production, you're absolutely right. We start out here in conceptual space, wherever that is, with the concept of an apple that we've recognized from the picture. You access the lemma form, the abstract word form, that involves the MTG. And you access the phonological form, that's in auditory cortex. And these levels then map onto motor systems. And it's not that you have to go from word to phoneme sequence to motor. There are multiple parallel connections. So there seem to be connections from word level stuff to motor related, or at least frontal systems, probably up here in anterior Broca's area. The phonological circuit connects through to more posterior Broca's areas at the phonological level. But the point is that on the production side, you use the whole system. You go from concept to word to phoneme to motor plans to hit those phonemes and so on. On the comprehension side, there's no reason to activate the motor side of the equation. You only need this mapping. Okay, so there's this fundamental asymmetry in recognition versus production, where production uses the whole brain, all the systems that you were talking about, including the sensory codes, whereas perception recognition doesn't have to do that. It only uses the recognition part. We've extended this kind of asymmetrical framework to syntax, where it works really well there too. So I think it's a fundamental sensory motor asymmetry that exists.
I want to. This is the top of the hour, and I'm going to take the opportunity to thank Greg, and pre-advertise the talk in 2 weeks, where Jeremy is going to continue the discussion, probably in a slightly different fashion, but again, it'll be auditory motor. And I'm really, really happy that you've been able to help us understand what's going on, Greg. And I want to thank you, and I think everybody else shares their gratitude. So thank you very much.
Thank you. I'm going to read through your questions, and then maybe I'll post on my blog some answers to it. So for those of you who didn't get answers to your questions, or feel free to email me as well. Thank you all.
Thank you.
Thank you.
Are we continuing, or we're done?
Looks like Greg signed off, so I guess
I'm here, so I can continue if you want. But it sounded like it was kind of a sign up, but I'm happy to continue. I've got nothing scheduled next, so.
I have 4 upgrade vivas tomorrow.
I have a simple question, Greg.
Yeah, sure.
How about perception and production of accelerated speech? Where does the sensory motor connection break down, and when?
Yeah, that's a good question. I'm not sure that that's been studied. Do you know of anything, Jeremy, where people have looked at, I mean, we can perceive those super rapid end of the radio commercial kind of speech, and And we can't talk that fast, or most of us can't. So I don't know if anyone's really looked at that. Interesting question, though.
Okay.
Well,
Greg,
we perceive the speech when we hear cartoons talking with very, very different ways of. When you hear Donald Duck, it's not a sound that we can make, but we understand the speech. So I think you're right. You get the information first, and then you go out to the motor.
Yeah. I mean, that's the general argument that I made for the mirror neuron claims, which were all about motor simulation being important for perceiving and understanding actions generally, including speech. But simplistically, we can understand flying and all sorts of things, birds flying and snakes coiling, and without having the motor ability to do that. So that it's got to be a limited, augmented kind of process if the motor system is contributing at all. That's absolutely right.
Okay. Well, thanks everybody. I just sent a note
I
out
have
saying, Dom was online.
Hey, hi, Greg. Thanks for this.
Sure.
We did some studies. It's well known that kids understand words long before they say them. So we had a database of individual kids, and we looked at their phoneme repertoires and showed that indeed they're understanding many words that have these phonemes that they're not able to utter. So that's another data source, I think, that supports that idea.
Yeah, that's interesting, Dom. Good to see you. I didn't see you in the array of things. I think Sheila Blumstein has done some similar things in aphasia, looking at voice onset time. It's a kind of an obscure study where they looked at patients who had deficits, production deficits in certain features, and then looked at whether they could perceive those features, and they could. So very similar to what you saw in kids.
Yeah.
Hey, Greg, some people asked in the chat about prosody. How does that fit into all this?
I think prosody is really interesting, and it's something that I've gotten much more interested in lately. So as I promoted this area SPT for years, I've thought of it as a vocal tract general kind of circuit. So in general, it's involved in controlling speech from larynx to lips. But we did some studies that suggested that it was more laryngeal specific. And so the current thing I'm trying to get funded, to be honest, is to really study SPT organization, the internal organization of it with respect to controlling different articulators. And I think it's going to be more laryngeal specific, which would place it, which makes sense with the music humming result, right? If you look back at that original work where we showed just as much activity for listening to simple melodies and humming as for listening to full-blown sentences and reproducing all of that phonological structure, that doesn't make sense. It's so much simpler to hum something. But if it's tuned to the larynx, then the two conditions, you have a sentence prosody and you have a simple melody, and those are more comparable. So I think prosody is going to be an important story in these sensory motor circuits. And that makes for an interesting evolutionary story too, because the acquisition of voluntary laryngeal control in our species seems to be an important precursor for speech and language ability. So that's kind of the direction that I'm looking. But we don't have a lot of data. We're trying to do it in stroke. And we're finding similar areas implicated with possible dissociations between, for example, the reproduction of melodies by humming in stroke patients versus reproduction of sentences, those abilities can dissociate. So it's a great question. Haven't explored it in depth, but I'm super interested.
Cool. Well, thank you very much. I really appreciate you doing this, and I think it's been a great discussion. I'll send you the video and the chat transcript later.
Okay, cool. All right, and I look forward to hearing you, Jeremy, in a couple of weeks. Good to see you all. Thank you so much.
Thank you, Greg.
Bye.